All right. Next up is Ryan West. Mr. West is the Director of Corporate Training and Business Development at Arc Point Labs, who will be presenting Redefining Workplace Impairment, a treatment provider's perspective. So, Ryan, I will go ahead and ask you to share your screen, and you're welcome to begin.
Very good. Thank you so much, Bradley.
Yep.
Give me one moment here, and we'll kick it off. Bradley, I'm going till 1:30, correct?
Yes, sir.
Very good. Well, hopefully this presentation will be a nice segue from the presentation you just heard. As Bradley stated, my name is Ryan West. I'm also the owner and president of Equalified, today representing proudly Arc Point Labs as the Director of Corporate Training. The topic is Redefining Workplace Impairment, a treatment provider's perspective. Over the next 25 minutes or so, we'll be going at a fairly high level, but we're going to cover these three objectives. The first, is you'll be able to summarize the connection between chronic stress, mental illness, and substance use. Second, identify common signs of chronic stress, mental illness, and substance use. You'll see there's a lot of overlap. And finally, discuss employer community-based and online resources for impairment prevention, underscored, treatment, and also recovery. Now, I am currently the Director of Training. I've done a lot of clinical and corporate trainings, but I spent the first 10 years in the substance use treatment industry working as a counselor and clinical evaluator. My primary responsibility was to assess, evaluate incoming prospective candidates, diagnose, and then prescribe treatment plans based on that diagnosis to give them the best chance of success and recovery. Hopefully you'll find within the context of this presentation that my experiences working as a counselor, as an evaluator, will make this presentation somewhat unique. And I'll pepper it with anecdotes and certainly with the science, with the literature states is most current. Now, I've never wanted to, I've actually intentionally avoided starting any presentation with a Merriam-Webster's definition, but I found it was probably the best way to go in this case. So I'm going to do that. Merriam-Webster defines impairment as being in an imperfect or weakened state or condition such as diminished in function or ability, unable to function normally or safely because of intoxication by alcohol or drugs. Now, historically, when people hear the word impairment, they think of the latter definition because of intoxication by alcohol or drugs, or perhaps because of fatigue or sleep deprivation. But I'm challenging and questioning whether or not maybe we should expand or broaden that definition. Working with hundreds, arguably thousands of patients over the years, 80% of them in the workforce. I'm not in the OGE industry, but I've certainly worked with and treated many patients who were coming from the OGE industry. Substance use, mental illness, and stress all cause some level of impairment, whether it was at work through motor control or thought control at home. There was a disconnection between them and their family. Their physical health was deteriorating. So the purpose of this presentation today is to just challenge our understanding of what it means to be impaired, and perhaps maybe broaden it to just include a diminishment in function or ability to not only get our jobs done safely, but also effectively. And again, historically, when we think impairment, we think a substance or fatigue, sleep deprivation, and its effect to the motor control centers of our brain, such as the cerebellum and the limbic structures, the subcortical structures. But we also have to consider not just a substance's effect, a drug's effect, amphetamine, marijuana, cocaine, etc., on our thought control, our ability to think clearly. The frontal lobe, right, houses our executive functions, thinking, planning, organizing, problem solving, mood, impulse control, so resisting underlying urges or emotions. Now, I'm not the only one who's challenging this historical understanding. The National Safety Council conducted a survey in 2020, surveyed 350 industry professionals with leadership or management level decision making authority. 29% safety, 38% HR, 33% other management, widely distributed across different sizes of companies, as you can see there on the screen. 31% industrial, 26% social services, etc. And they had asked these 350 professionals, should we broaden our understanding of what it means to be impaired in the workplace? Should it go beyond things like chemical substances, alcohol and marijuana? Should it go beyond things such as physical factors like fatigue? Should it include social factors such as stress or mental distress, mental illness, mental health? The overwhelming majority, 93%, at least somewhat agreed. 64% strongly agreed that we should broaden our understanding of what it means to be impaired. And what you're seeing here on the screen is kind of a breakdown of the different categories: alcohol, chronic stress, fatigue, and how many of those 350 respondents expressed a major concern, minor concern, and not a concern at all. Alcohol was a significant concern, a major concern at 63%. Number one was illicit opioids such as heroin or fentanyl. But mental health disorders and chronic stress came in fairly high, 60% for mental health disorders. 60% expressed that mental health disorders were a major concern of potential impairment, that they would cause impairment. And chronic stress, 54%. Only 8% said not a concern at all. So when we experience acute stress.
This is Bradley, can you hear me? I hate to mention this, I don't mean to interrupt, but could you change your display settings? We're just seeing the notes slide rather than the full presentation slide. And I think we've gotten a couple of notes in the chat that it would be helpful to see the full thing. So if you go to display settings, you may be able to switch.
Sure, forgive me for that. Is that better, Bradley?
And go to, there you go. That's perfect. Thank you, sir.
Is that better? Okay,
Yes.
Thank you for letting me know. I would never have known that. Okay, so when a person experiences stress, acute stress, that can be a really good thing. In fact, our stress system evolved over thousands, arguably millions of years to help us overcome challenges, to help us overcome threats, obstacles. So these hormones and chemicals in our body get released to prime our muscles, to prime areas of our brain, to overcome challenges, threats, obstacles. So it's helpful in many ways. But when we're experiencing chronic stress, these elevated stress hormones, namely cortisol, actually change the way that our body and our brains function. Key areas of our brain will actually change, namely those involving mood, memory, problem solving, impulse control, and it reorients our motivations towards short-term gratification. In other words, if we can't resolve a problem, it builds, and that goes from acute stress to chronic stress. If we can't fix it, we start to look for ways to escape. We look for relief. And the relief that we seek tends to be maladaptive, especially in the United States of America. Things like drinking or using substances. If you're working 12 hours a day or 14 hours a day, 6 days a week, you don't have enough time to decompress, to fall asleep and get 7 to 8 hours. But alcohol can help temporarily. It's a terrible long-term strategy, but people engage in it because it's an effective short-term strategy. And what you're seeing here is a SPECT scan highlighting an area of the frontal lobe known as the ventromedial prefrontal cortex. It's a mouthful, widely studied area of the brain that's thought to kind of govern impulse control and kind of fight back and resist underlying urges and impulses from subcortical regions like the amygdala. So when we're having a very tough, stressful day, we tend to act on impulse when we're irritable. We don't deal with minor stressors very well. The area of the brain that typically deals with them is not working as well as it should be. So I have to ask, based on the definition of impairment that I brought up before, is there some level of impairment if a person's not drinking alcohol or using drugs? They're not necessarily sleep deprived per se. They're just experiencing chronic stress or maybe mental illness. Are they thinking as clearly? Are they maybe less likely to stay on task, follow the safety program? Are they going to be more forgetful to follow instructions? Is there a diminishment in function and ability to be safe and effective at work? If the answer is yes, perhaps we need to broaden our understanding of what it means to be impaired. Now, I'm going to go over some common symptoms of chronic stress, 3 categories: emotional, mental, physical, and behavioral. We'll start with emotional and mental. When we get to behavioral, I want you to take note, careful note, and think about mental illness and substance use and see if there's any overlap or what the connection might be. Many of the patients that I saw, well, actually all of the ones that I saw, I can't say every patient with addiction or mental illness is chronically stressed. Although I would make a prediction that the majority of them are. Every single one of the patients that I saw that was coming into treatment was experiencing significant stress. And coming to treatment is not necessarily a fun thing. And if the substance use or the mental illness, the co-occurring disorder is not stressful, quitting a drug that you've relied on for many years is very stressful. So the cessation can be very, very stressful for people. And they experienced many of these emotional and mental symptoms: anxiety, irritability. Many were short-tempered. When we're experiencing chronic stress outside of a mental illness or an addiction problem or substance use issue, we can be very sensitive to smaller stressors. You know, having a good day or a series of good days or good weeks, it makes us more resilient to stress. When we're sleeping, when we're eating, when we're exercising, when we're connected to family and friends, we're more resilient to the small stuff. When we're already under an enormous amount of chronic stress, the smallest things can set us off. Long-term, chronic stress is extremely correlated, positively correlated to depression, to anxiety. Some people may experience panic attacks. These are all symptoms of an unresolved issue in this person's life. Some may feel numb. They may say that they feel nothing, that there's really no high or no low. And in addiction, we refer to this commonly as anhedonia or pleasure deafness. I don't really feel much of anything. Again, symptoms of some other underlying issue, whatever that may be, or issues, whatever that may be. It could be an excessive workload. It could be some interpersonal conflict you're having, or both. It could be financial issues. The list goes on. Many people that have physical symptoms are having physical symptoms that are manifesting out of this unresolved chronic stress. Chronic stress is, again, like addiction, like mental illness, anxiety and depression, is correlated to cardiovascular issues. People that have unresolved chronic stress are more likely to have cardiovascular events, heart attacks, GI upset, stomach issues, can even experience dizziness, chronic headaches, or the resurfacing of headaches or migraines, loss of libido. They can get sick more often and stay sick, longer. And they can even have autoimmune issues. Really interesting studies, epigenetic studies, which is the study of how our environment affects gene expression, have taken place over the last decade or two. Some people getting fibromyalgia or MS or ulcerative colitis in their 30s, 40s, and 50s. These are autoimmune conditions. Why are they developing? Perhaps out of unresolved chronic stress. At least that's what the research is now suggesting. And behaviorally, people with unresolved chronic stress may experience an increase in drinking, as I said before, as a means to cope, to deal with it. Effective short-term strategy, terrible long-term strategy. Maybe they start smoking, or they increase the amount of smoking. Maybe they start gambling. All of these behavioral symptoms, overeating, shopping, internet browsing, compulsively, staying on your phone, all of these release feel-good chemicals, not just dopamine, our endocannabinoids, our natural THC, endorphins, our natural opioids, our natural morphine. All of these behavioral symptoms give us short-term pleasurable experiences that can be very addictive, or can help us to develop an addiction long-term, which in and of itself is very stressful. The defining feature of addiction is continued use despite consequences. If you're having consequences, legal consequences, health consequences, marital consequences, family consequences, occupational consequences, and the list goes on, that's stressful. And so chronic stress can create physical and behavioral and mental symptoms that later become their own disease states, which creates more stress for us. And so if we don't resolve it, it creates a feedback loop and can keep us stuck in that feedback loop, arguably impairing our ability to show up to work on time and to do our jobs safely and effectively. Now, a lot of the patients that I would see, they'd be displaying facets of denial, and it was never that bad. They'd minimize, they justify, rationalize why they do it. They blame others. They compare. It's just beer. It's not liquor. It's just liquor. It's not heroin. So these facets of denial protect the ego, and they minimize guilt and minimize shame, allow the person to keep doing what they're doing without experiencing those negative emotions. But eventually, when they would enter into that state of recovery, it was undeniable that all of those symptoms that they were experiencing were unquestionably perpetuating the chronic stress issues that they were having. And so many of the patients that I did see, when you do an accurate historical analysis and assessment, you trace it back, you trace the onset of their substance use back to usually 1 or 2 points in their life where they were either succumbing to peer pressure, or they started drinking more to deal with job stress, or there was a divorce or something happened. They started using substances to deal with it. You're in the field long enough, you start to see that theme over and over and over again. When I do teach substance impairment classes or reasonable suspicion classes, I'll commonly go over appearance indicators, behavioral indicators, performance indicators. Now, appearance indicators are really the only thing that suggests substance impairment is causing what you're seeing. Pinpoint pupils, dilated pupils, unusual sweating, etc. But when we get to behavioral indicators, sleeping, absenteeism, presenteeism, showing up to work, but you're not effective, and your body's present, but your work is not, being erratic, unpredictable, avoiding people, isolation, that's not unique to just substance use. That could indicate chronic stress, that could indicate burnout, that could indicate a mental illness, or all three. The same with performance. This could indicate a substance use issue, but could also be indicative of an unresolved chronic stress issue or a mental illness. Now, you don't have to put your answers in the chat. You can just answer out loud or in your head. But in 2021, it's estimated that 36.1 million American adults needed treatment for a chemical addiction. This is according to the most recent data from the National Survey on Drug Use and Health, published by SAMHSA. What percent do you think received specialized treatment? And by specialized, I mean they entered into a rehabilitation center, received formal treatment, met with a counselor and or a therapist. This is out of roughly 335 million people in the United States, about 10% diagnosable addiction problem to a chemical. The answer is about 8%, 2.94 million. Again, according to the most recent data, it was just published this year, even though it's from 2021. Due to numerous factors, many that I just named, shame, guilt, the stigma of substance use, denial, there's a lot of reasons why people with addiction don't seek help, even though it's very treatable. But mental illness is better, right? Those that are experiencing mental illness, the rates are higher. 75% of individuals with a mental illness receive professional help during any given year. True or false? This is also false. The good news is it went up to 47%. The bad news is it's still 47%. So while it's higher than substance use, it's still much lower than we'd like it to be. And what you're seeing here, the most recent stats from SAMHSA, showing individuals with any mental illness, minor, moderate, severe, receiving mental health services in the past year, 47% overall. And you'll see here that females, and they consistently are year over year, far more likely to receive help than males. Good news is this number has gone up for males considerably over the last few years. And I think that was one of the silver linings of the pandemic, is that seeking help for chronic stress, mental illness, and even addiction became a little more acceptable. And so people started reaching out. We saw a significant spike in anxiety, also depression, and also substance use, fear of touch, fear of contracting COVID, 3 universal factors for stress: lack of information, a loss of control, and uncertainty. That can cause a lot of stress for anybody, adults, children, and the like, and every age group in between. But again, the silver lining that came out of that pandemic is more people became aware of the effects of the pandemic it was having on them and their family members, from isolation, et cetera, from getting sick and the fear of getting sick. And it was being promoted more by workplaces, by the public, by the CDC and other health organizations. It's okay to get help for yourself. Unfortunately, many people did, but there's still a stigma. There's still a fairly significant stigma that prevents a lot of people today, perhaps people listening in right now, that are struggling from getting help. So I have 2 images on the screen. On the left, you have 2 individuals working out on a treadmill. And on the right, you have a gentleman presumably interacting with a counselor or a therapist. We'll say that he is. You walk into a gym, you see people exercising. They're on the treadmill, they're on the elliptical, they're doing some free weights, maybe some sit-ups, pull-ups. Perfectly acceptable. In fact, if you go to a gym, that's why you're there, right? To optimize your physical health. Physical fitness is okay. but there's still this belief by many that it's not okay for them to get help for themselves. It's okay for others to get help. It's okay for you to get help, or for you to get help, for family to get help, for friends to get help, but not so much for ourselves. We have to continue to encourage people to get help for themselves, and we have to also be willing to prescribe our own, or to consume our own prescription. If we would tell somebody else to do it, we have to follow that. So along that thinking, I want to go over a quick scenario. Stress scenario, including depression, anxiety, and alcohol misuse. You and a friend are on break, you're drinking coffee, chit-chatting about life and work. After a few minutes, your friend tells you that they've been under an enormous amount of pressure and stress with work and family obligations. You sense the stress in their voice and you just listen. They eventually reveal a nightly drinking habit of 8 to 12 drinks, which is a lot. They're not sleeping well. And they openly share they've been having suicidal thoughts, though they emphasize this is not something that they want or would ever do. After sharing all of this with you for about 10 minutes, they ask for your advice. Again, you don't have to put it in the chat, but what would you say to them? What advice would you give? Would you negatively judge them? Would you berate them, point the finger, tell them you need to do this or that? Maybe. But my guess is you'd probably express some level of empathy or compassion. You'd probably say something like, man, I'm really sorry. That sounds really hard. What can I do to help? Have you tried this? You'd start to problem solve. But we wouldn't necessarily, again, follow the prescription that we're giving them. It's sometimes harder to take our own medicine. What I'm talking about here is something called self-compassion. So coming from the National Institute of Mental Health, NIMH, except for this one right here, all the other tips that we're going to talk about are coming straight from that website. The first is practice self-compassion. A lot of the clients that I saw that were dealing with life impairment, work impairment from stress, depression, anxiety, and substance use had a really hard time practicing self-compassion. They were very compassionate and supportive of others, but not themselves. We want to be mindful to follow the exact same advice that we'd give somebody else. We want to treat ourselves like a friend in a way. Number 2, sleep, 7 to 8 hours per night. Easier said than done, I understand, but it's undeniable at this point. People who are sleep deprived, it's just going to compound the stress. It's going to increase the likelihood that we do reach out, maladaptively use substances or technology or other addictive things to deal with the stress or to help us sleep. Exercise, the most underutilized antidepressant, without question. Exercise if you can. I mean, if you can, because you're working long hours, diaphragmatic breathing has been really helpful. I get a lot of eye rolls in my trainings when I talk about breathing. I say, you're doing it anyways. You have to. So why don't you do it with a little supportive science? The science shows that when we breathe out more slowly than we breathe in, it activates the parasympathetic nervous system, the rest digest. It starts to clear cortisol and other stress hormones, can even slow down our heart rate real time, as little as 1 or 2 diaphragmatic breaths. And we can do that anywhere, on the job site, on the way to work, on the way home, when we first wake up, when we go to bed, in the shower. We can do that anywhere. Sometimes the littlest exercises, the little bit of work we do to promote health can have a really big impact when we do it consistently over time. Eat nutritious foods. If we're fueling our body with junk, garbage in, garbage out. Unfortunately, many people who are sleep deprived, which I know there's a multitude of psychosocial stressors in the OGE industry. Again, I'm no expert, but anybody can simply Google that question. What are some psychosocial stressors in the OGE industry? Working long hours and sleep deprivation is commonly found in just about every single website that I clicked on. And so we wake ourselves up with caffeine and we put ourselves to sleep with alcohol. Perhaps somewhat of an effective short-term strategy, terrible long-term strategy that's going to perpetuate our issues and create other health issues, such as addiction, physical ailments, other disease states, depression, that we then have to deal with. I have sleep, eat, and exercise C. You'll notice that they're bold and underlined for a reason. As I have found in my practice, and the literature supports this as well, that when you get enough sleep, when you exercise 3 to 4 days a week, and when you eat nutritious foods, so much of the stress in our life is easier to deal with. We start to problem solve more effectively. It's healthy for our brains and our bodies. It just makes us more resilient. It makes us more problem solvers. It helps us to adapt with health sustaining long-term strategies instead of health draining short-term strategies. Journal or gratitude, get a lot of eye rolls for this one too. When we journal, when we write, it forces our brains to slow down. When we're feeling anxious, when we're stressed, we tend to run at a high level. That's what stress hormones do. They make us run fast. When we journal and we write, it forces us to slow down because we can only write as fast as our thoughts really can keep, our thoughts are forced to slow down with the speed of our writing. And it's really hard to be upset, pessimistic, grumpy when you're focused on all the things in life that you're grateful for. An easy way to do this is think of 3 to 5 things in your life that you enjoy and imagine if you didn't have them, what would your life be like? That can really help you connect with gratitude and appreciation. You can download free relaxation apps. There's many out there. I won't name any. I don't want to in any way seem to endorse these apps, but there's dozens, if not hundreds of free relaxation apps that anybody can download from the Play Store. Stay connected. Some individuals, especially men, historically men, have a harder time connecting or being emotionally vulnerable with people, which is why they're not as likely to seek help for mental illness. They will disconnect, they will isolate, if not physically, emotionally from family and friends. But the studies suggest that when we are connected, when we lean into our support system, it helps us deal with stress more effectively. Disease states, mental, emotional, addiction drops. One of the most powerful aspects of treatment is certainly the treatment is powerful, but it's the peer support group. It's leaning into others that have walked the path you're on. That's where the real power and the real healing takes place, is for many is in group therapy or 12-step. Identify and challenge negative and unhelpful thoughts. This is the essence of cognitive behavioral therapy. Negative thoughts, thought distortions create negative feelings. These negative feelings create negative behavior. The negative behavior creates negative thoughts. We get stuck in this. Identify these thought distortions by speaking to a professional. Use your insurance. If you don't have a behavioral health benefit, that's okay. A lot of community-based supports out there. I do have a 3-page handout I created that's got more than this. Just put some on the board for an example. I'm happy to send it to Bradley. You can distribute it or you can email me directly at the end. Happy to send it to you. Smart Recovery, Alcoholics Anonymous, Narcotics Anonymous, Recovery International, Support Group Central for Mental Health, and 24/7, 365 crisis hotlines. There's so many free resources available. Another benefit, a silver lining of the pandemic, more resources became available and more people became aware of them. Use them. And if you have an employee assistance program, sometimes called a workplace wellness program, as we wrap this up, don't use it as a reactionary measure. Certainly you can. That's what it's there to help support you when there's an issue at work, an employee issue that's involving performance or substance use or mental illness. It's there for you. But we want to use it to emphasize prevention as well. As Ben Franklin said many, many years ago, an ounce of prevention is worth a pound of cure. It's so much easier to prevent various diseases. It's easier to prevent addiction. It's easier to prevent cancer and diabetes than have to treat them. They are treatable conditions, but it's better to prevent them in the first place. It's better to address stress when it's acute or in the early stages of being chronic than to wait 1 or 2 years, because now you're probably going to have a variety of other issues that are impairing you at work and in life. Increase awareness. How many trainings have I done on substance use and mental illness? They have an EAP, but nobody's aware of it. HR doesn't even know who it's with. So post flyers, post them in their office, post them in the break room, talk about it, advertise it. If they don't know it exists, how can they benefit from it? And third, reiterate confidentiality. This is a big one. There's still a stigma out there. People often want to get help long before they actually do. I've seen, as I said, hundreds, thousands of patients. Many of them told me, I knew it was a problem 1.5 years ago. It took me this long just to muster the courage to come see you. I was so embarrassed. I was so afraid of losing my job or losing face. Let people know that it is confidential. And contrary to popular belief, the majority of clinical reasons why people access an EAP is not drug and alcohol. It's mental health. This is according to the most recent data from the Workplace Outcome Suite. So let them know that it's okay to seek help for mental health, substance use. Get help so that it doesn't affect your performance. So you can show up to work, stay focused on your job, and do it safely and effectively. All right, I know that was really fast. We went at a very high level, but at this point, you should be able to summarize the connection between chronic stress, mental illness, and substance use. Intimately connected. Mental illness and substance use are often symptoms and born out of unresolved chronic stress. You should be able to identify some common signs of chronic stress, physical, emotional, and behavioral, and discuss some employer community-based and online resources. If you want to get a hold of me, my information is on the board. I would advise you not to call that phone, but to reach out to me via mobile or via email. My email is not on there. I apologize. It is rwest@arcpointcorporate.com. I'll put it in the chat. Bradley, back to you.
Great, Ryan, wonderful presentation. We're getting a lot of comments in the chat about how great people thought that information was. So thank you very much. A couple of comments came in, I think from workers about how much isolation, particularly for those who are doing fly in, fly out, or having to travel, to remote locations to do work for extended periods of time, really is a contributor to kind of that chronic stress that you're talking about. So, definitely an issue that a lot of our workers are facing. I don't see any open questions in the Q&A. We are at 11:32, which is kind of at our time to move into our first break. So just wanted to say thanks. I do see your email in the chat. So if anyone has further questions for you, you may be receiving some for email. So if I could ask you to stop sharing your screen real quick.
You got it. Thank you for having me, Bradley. Thank you, everyone.
Thank you, Ryan. All right. So we are moving into the time for our first break. We will be keeping this slide that you see up here during the break, thanking those associations who helped advertise our summit. And we'll continue in about 10 minutes at approximately 1:40 p.m. Eastern time, at which point I will be handing off moderating duties to a colleague, Erin Mabry. So thanks, everybody. We'll see you in about 8 or 9 minutes.